Hi, everyone. This is Steve D'Alessandro, and welcome to this week's edition of CEOs You Should Know. I am joined by two doctors from Northwell Staten Island University Hospital that I'm thrilled to be here today. So let me introduce you to one, Dr. Chika Madu, the chair of radiation medicine, and secondly, Dr. Romanos-Sirakis, the director of pediatric oncology. Thank you guys for being here.
Thank you for having us. Good morning.
Thank you for having us.
We're excited to jump in and learn a little bit more about the both of you. So to kick things off, I'd love to start a little bit about both of your paths and what first drew you to oncology and how that really has helped both your personal and professional lives.
Shall I start?
Who wants to kick it off?
I'll start. What drew me to pediatric oncology really was the extraordinary blend of both science and the long-term relationships that we have with our patients and families. I was always fascinated by the complexity of cancer biology and also all the great treatments that we had for patients. But what really truly moved me was seeing how deep our relationships could be between our patients, our families, and our care teams. So I worked and trained at NYU prior to coming to Staten Island University Hospital. And I can remember day one of my training, I cared for a young patient who was so resilient in the face of cancer. They were there making me smile. They were telling me stories. Their family had such unwavering strength. And that stayed with me long after my first day of being a doctor. And that experience truly changed me. It showed me that this field is more about treating the disease. It's about walking alongside people during some of the most vulnerable moments of their lives and helping them through this journey. So these are some of the experiences that really shaped how I practice today. I not only focus on delivering the most advanced, up-to-date care, but also on being present, listening deeply, and honoring the experience that every family has because it's a personal experience. I've learned that every small gesture, it can be a conversation in the right moment, actually just sitting in silence when needed, or celebrating milestones. And in peds oncology, we love to celebrate every milestone we can, are just as important as the clinical decisions we make. I will say that pediatric oncology definitely demands everything from you, both intellectually and emotionally. But it gives me a profound privilege to make a difference in ways that stays with people forever. If I am able to cure a disease, ease some symptoms, and also get smiles and laughs from a child and their family, then I'm doing something right. And it truly is an honor and a privilege to be part of their journey and their lives.
That's awesome. Dr. Madu?
So my first introduction to radiation oncology was in medical school, and it was just by happenstance. So in med school, we had career seminar series for the first year med students. So once a month, they'll serve pizza. So I showed up. And they'll have physicians from different subspecialties, right? So you know about internal medicine, pediatrics, surgery, the general stuff.
Sure.
But the subspecialties that most people don't hear about, they'll have physicians from those subspecialties come and talk about their field. So the chair of radiation oncology at the time at University of Michigan came and spoke about radiation oncology, and I thought it was the coolest thing ever. It combined technology, which I loved, with the care of patients, walking alongside patients through the most difficult times of their lives, but being able to create change by harnessing the power of technology, harnessing the power of collaboration with other medical fields. So I did some research in the field between my first and second year of medical school, and that was it. I was sold, and that's how I ended up in radiation oncology. And like Eleny said, it's a privilege to be able to walk alongside patients and their families. I've treated patients, their family members, right? So it's sort of word of mouth. Even when you treat a patient and they don't survive because it's just a bad cancer, I'm always amazed when someone else in that family gets cancer and they send them right back to me, right? So it's just, that trust that you build with the families, that's what keeps it going.
We could definitely tell you both really care, and that's one of the most important things. So thank you both for all you guys do. Both of your careers have spanned with the clinical and academic leadership. How has your journey through education, research, and direct patient care really influenced your role in shaping the future of cancer treatment?
I can start.
Sure.
So, you know, there are two aspects to it. So
Sure.
there's the clinical care, right? So I'm aging myself now. I finished my training in 2008, so it's been a while, right? So as you do it over and over again, it becomes kind of like riding a bike, right? Second nature. Um, but the other part of medicine that is not taught in medical school and not taught in residency is leadership in medicine. It's just, unless if you get an MBA while you're in med school, you're not going to know that stuff. So the great thing about Northwell and what they're doing is they have established physician leadership development programs and executive leadership programs, both of which I've taken through Northwell. And it gives you a different view of medicine and how to operationalize things. And when you look at how things are being run, if it's working, great, you make it better. If it's not working, then figure out a way to make it better. But being on both sides actually gives us an advantage to be able to raise health for everybody.
Okay, I will piggyback off of that. So, my journey through clinical care, education, and research really has given me a full 360-degree view of what it takes to move the field forward. And more importantly, how to do it in a way that keeps the patients and their families right in the center and at the forefront of our care. As a clinician, I see firsthand the urgency of our work. I see the faces behind all the statistics, the gaps in access, and the incredible strength of the children and our families facing cancer. And that's the daily connection that really grounds the decisions that I make. Then, as an educator as well, I understand the importance and the power of investing in our next generation, teaching them not only the science, but the heart of oncology, which is so important. And it's about shaping thoughtful, resilient, compassionate leaders who will carry our work forward. And lastly, as a researcher, I'm committed to discovery and looking at what are our current clinical problems and questions and how can we best answer them. How can we make things better for our patients? And I think together these experiences have shaped how I lead. I really truly have a focus on collaboration, equity, and innovation. My goal is really to build bridges, to accelerate progress, and to ensure success and innovation through the future of cancer treatments.
Thank you both for sharing that. Dr. Madu, I know that you've been leading advancements in radiation oncology while at the same time driving initiatives around diversity and equity in the clinical trial space. How do you balance the clinical innovation around health equality while having that integration that's so critical to today?
It's so hard. It's
so Doesn't sound easy.
It's so hard, but it's so important.
Yeah,
right.
Absolutely.
And we can't move forward without it. So on a national level, I chair the Committee on Community Engagement and Advocacy for ASTRO, so that's the Association of Radiation Oncologists. And part of our goals are, number one, access, screening, making it accessible for many patients. And then number two, clinical research, right? So you have lots of clinical trials that are open out there, and we can't advance cancer care without doing the research and figuring out better ways of curing cancer.
For sure.
Who's enrolled in the clinical trials? What is the population of the United States? Do they match? They do not. So then the question is, why is there a disparity with regard to who's enrolled when you look at the population of the United States? And then we start to sort of dig into what are the potential barriers. Is it because it's lack of trust? Is it because we make the inclusion criteria into clinical research so tough with things that are not scientifically necessary? That way, you're now filtering out a lot of the population that really should be enrolled in that clinical trial. And why is it important to have everyone enrolled in clinical trials? If there's a new drug development or different kind of radiation treatment or medical treatment, how do I know that it's equally as effective in all populations? I'm not going to know that unless if I have enough enrollees from all the different populations. So our goal is to try to make a lot of the research bodies understand and hopefully shape how they create and design clinical trials to eliminate some of the barriers that we know that are in the way. Things like financial toxicity. When you have a single mom who's on an hourly paid job, so we have to be able to manage them being able to keep their job
Yeah.
and being enrolled in the clinical trial. So there has to be some level of financial incentive for transportation,
Yep.
for the missed day at work, because now they have to be in my clinic doing follow-up for this clinical trial. And then looking at our inclusion criteria, making sure that all of the exclusion criteria are scientifically necessary. And then just sort of, looking at rapport, like Eleny said, just how are we approaching patients regarding clinical trials? We should eliminate bias, unconscious bias, and not look at someone and say, well, that person's probably not going to want to be enrolled in trial. You present it to everyone.
Yeah.
And ASCO has done trials in this, and if you present the clinical trial to everyone, 50% will say yes, and it doesn't matter which population. So that's our goal, is to continue. It's hard work, but it requires persistence and perseverance to continue to change how we structure clinical research design so that people can enroll.
Yeah. Hard work, but very important work that will make a big impact on the future too.
Exactly.
Great stuff. Dr. Romanos-Sirakis, now question for you. You co-developed the Pediatric Comfort Campaign and authored a pediatric palliative care curriculum. What inspired these innovations, and how has it really transformed the experience overall?
Great question. So these are some of the things I'm very passionate about. And the inspiration for these programs really came from a very simple but powerful truth that children deserve to feel safe, they deserve to feel supported, and they deserve to feel understood through every stage of their cancer treatment and their journey. And this work spanned even beyond pediatric oncology to involve all pediatric patients, because it's important for all pediatric patients to feel safe, supported, and understood. So over the years, I saw that the emotional and physical suffering could be eased with early and intentional support, and continue all of this throughout treatment as well. So it empowered clinicians and our trainees to feel more equipped to have difficult conversations and to offer more of a level of comfort-focused care. The Pediatric Comfort Campaign itself was designed to shift our culture, to make comfort and emotional well-being a core component of care and not just an optimal one. And then when it came to the palliative care curriculum, that was created to empower our trainees and our staff to give them the skills they needed to communicate with compassion, manage symptoms throughout care proactively, and also to walk alongside families during really incredibly complex moments. So I believe that these innovations truly have helped to transform the pediatric experience at our hospital. Every plan we make is individualized and focuses on the patient and the family's individual needs. Families continue to feel more supported, children feel more at ease, and our care teams also feel more confident and connected in how they show up for patients. So not just as medical professionals, but as humans as well.
Yeah, absolutely. That's really important work, both for the patient and the family, so you're making a big difference there.
Absolutely.
Great stuff. So for the both of you guys, I know that the state-of-the-art cancer centers that are now established in Staten Island have been game changers. How have you been leveraging the infrastructure to push the boundaries of innovation in cancer care?
Sure.
So the other hat that I wear
Lots of hats.
Too many hats. Is as medical director of the Florina Cancer Center. And the background behind it is there was a young lady, Florina Marchi-Russi, who was diagnosed with breast cancer at a very early age, and after a while, unfortunately, succumbed to it. And her family was so devoted to making sure that there was increased access to care and, just to offer better care. They donated a significant amount of money toward our breast surgery center, and that took off, and that was beautiful. And then after a few years, we've been talking about, getting everyone in the same building. So radiation oncology was in a different building, medical oncology was in a different building, pediatric oncology was in a different building. It was a mess. So the goal was to build this magnificent building and get everyone together and all of the subspecialties, including all of the help that we need to get the patients through their care. So in this one building, you have pediatric oncology, you have medical oncology, you have radiation oncology, we have pharmacy in there, we have social work, we have nutritionists, we have our patient navigators. When a patient walks in, there is someone who's walking them through every step of the way. If they need radiology biopsy, they're always helping them. We have a pediatric life specialist who is awesome, with the children. So our goal is to, in this building, offer multidisciplinary care. That way, when a patient comes in, let's say for a complicated pancreatic cancer, you should be able to see the surgeon, the medical oncologist, the radiation oncologist in one day so that we can come up with a cohesive plan for the patient and then have the patient navigator kind of walk them through the process.
Makes sense. Yeah.
Clinical trials also in the building. We have lots of clinical trials that are open in conjunction with the Cancer Institute as a whole. And being able to offer that then gives Staten Islanders, right, the opportunity to stay on the island for their cancer care. When you're getting cancer care and you're getting chemotherapy or you're getting radiation is every day. Who wants to truck into the city every day? It's just difficult. You're tired. And it's also a strain on your caregivers as well and on your family. So we're offering state-of-the-art technology. We're offering state-of-the-art chemotherapy. And then the supportive services all in one building, clinical trials, and that keeps our patients on the island instead of adding another stressor to their lives.
Yeah.
So I can approach that from a pediatric perspective as
Sure.
well. So with the establishment of the new cancer center, we were very intentional about designing not just the facility, but an environment that puts patients and their families at the center of everything. The space is warm, it's open, and most importantly, our area is child-friendly. And that has had a really powerful ripple effect. We've seen a meaningful increase in our patient volume, particularly from, as mentioned, families who previously may have traveled long distances for specialized care that we can now offer on Staten Island in their own backyard. The growth has created new opportunities for us to innovate. Ultimately, the infrastructure has allowed us to reimagine what comprehensive family center oncology care looks like. And I like to say, finally, the facade matches the beauty, the heart, and the brains of our care team. So we're pretty on the outside now,
That's
as well
awesome.
as well as giving everything that the patient needs for comprehensive care.
That's awesome. I know you mentioned one of the advantages also having Staten Island residents get to stay on the island. And I know Staten Island has some of the highest cancer rates in New York City. What is your long-term vision for improving outcomes and access to care in this community, particularly the underserved populations?
I agree. Access, right? So we have to get to the patients where they are, right? Not just putting up our sign and saying, oh, come to us, right? We have to get to them. So right now with our community events department, we're able to go out to different communities and we have tabling events. We partner with some of the companies in town. So when something's happening, we'll go there, we'll go to churches and basically create awareness around everything that Northwell is able to offer on the island. Screening, right? There's nothing like catching a cancer early, taking care of it early so that we don't end up having to have complex treatments for that cancer. There are few things, that you can't catch with screening, but a lot of them you can, right? So things like breast cancer, right? We have the mammogram, we've got the ultrasound, cervical cancer, we've got vaccines that you can start doing at an early age. But even if you didn't get the vaccines, there's no reason why we can't get a pap smear, right?
Yep.
And you can catch these things early before they turn into cancer. Colon cancer, right? So we're seeing colon cancer diagnoses in younger and younger patients, right? So we can do a colonoscopy, and then depending on your risk level, create your follow-up accordingly. But if we can catch these things early, partner with the community, then we can get them in a timely manner, offer timely cancer care, and then timely follow-up care as well.
Anything else you want to add?
Sure. So again, I will echo that access to care is very, very important. I want every child, no matter their zip code, to have access to the most advanced treatments. We are working toward enrolling pediatric patients across Staten Island on clinical trials, which is something new for Staten Island, and we would be the only site available on Staten Island offering clinical trials for pediatric oncology. So that's really exciting for us. Everything that we have learned and used working in Manhattan in the past, we are bringing to the patients of Staten Island, making sure that access is local. We want to ensure that top quality care is available locally. And I want to emphasize that we really have succeeded in bringing the comprehensive cancer care closer to home. And also, I want to say that we continue to partner with families in a way that honors their lived experience, because everybody is different, and we individualize care in that way. So ultimately, my vision is that every child diagnosed with cancer in our region receives not only world-class care, but care that feels personal, individualized, accessible, and equitable. And that's how we'll improve outcomes going forward.
That's awesome. It's such a nice burden to take off of the patients and their families to have you guys so close to home and have all that amazing technology and cutting edge. So that's great. Dr. Madu, I know you're the chair of the radiation medicine. How are you shaping, moving forward, the department's strategy to prepare for the next generation of oncologists to deliver and continue that cutting edge and compassionate care?
I have to say I'm a little jealous of the newer generation. When we trained, technology was not this good.
They're
right?
lucky.
It was not this good, but luckily for all of us humans, technology has improved, right? So there's so many things that we can do, we can modify to sort of make that experience for the patient better. So let's pick breast cancer. Typically, and some people still do it now, but I can tell you in our department, we are tattooless, right? So that means when a patient comes in for their planning session, back in the day, you get the ink, you have like a couple of marks on your skin, and it's always a constant reminder when that woman looks in the mirror of their breast cancer treatment, their breast cancer radiation pathway. We're tattooless, right? So now we use sort of the skin contour infrared light, and we're tracking motion of the body, and that's how we're making sure the patient is in the right position every time. That way you can come in and get your radiation treatment for the breast and go home, and I don't have to remind you every day that you had breast radiation. Things like protecting the heart when you do radiation. Things like adaptive radiotherapy, meaning we can, on the fly, redo a CAT scan, replan the radiation. Let's say for head and neck cancer patient who's got bulky node, and then they're getting chemo, they're getting radiation, and it's getting smaller. I can, on the fly, adapt my radiation therapy plan to what it looks like now. So this is exciting technology for all of our trainees, all of our young attendings, and we're working on getting one of those machines at Staten Island. It'll be great for the community. That way we're able to offer the latest and greatest to our community.
That's awesome. Exciting stuff.
Yes, yes.
Dr. Romanos-Sirakis, your leadership in research and facility development play a key role in advancing pediatric care. How do you strategically prioritize innovation, education, and mentorship across these programs?
That's a great question. There's not enough hours in the day. But I will say that I view all of these not really as separate goals, but as our interconnected responsibilities in how we shape the care for our children and our families. So in terms of education, I prioritize that by making sure that our trainees are not just learning the science of pediatric cancer, but also the human side, because that's so important. How to communicate with families, how to lead with empathy, and how to advocate for patients. Those are really important skills that they have to learn. And we want our future doctors to be healers, to be scientists, and listeners all at the same time. On the innovation front, we try and foster a culture of curiosity. With every challenge, there's an opportunity. We can ask, how can we do better? How can we improve the lives and care of our patients? and we're constantly looking for ways to move the field forward. And we involve our trainees in every step in that process because we want them to learn to think creatively and critically from the start. And lastly, the mentorship piece of it, I think that's the thread that holds everything together. I believe strongly in investing in people, guiding them through not only their clinical work or research projects, but through growth as leaders, colleagues, and caregivers. Those are all really important. We've built formal mentorship structures and programs in place to ensure that no one is left navigating this journey alone, which is really important. So at the end of the day, I think when you think about the education, the innovation, the mentorship, it's all about building a better future for our patients. When we support our teams to learn, to question, and to grow, that's when we give our children and families the very best care that we can. And it leads to growth for the future.
Absolutely. You both seem to be doing an incredible job of passing it forward and getting the next generation and chapter ready to take over too.
Absolutely.
That's awesome. Both of you guys lead in oncology, and I know especially during times there could be rapid change and things could be very demanding. And we've talked, there's not enough hours in the day a lot of the times, right? What has been each of your greatest leadership challenges, and how did you navigate those?
Time. It's, not enough hours, and finding a way to sort of balance it all. There's no balance, right? It's just something wins
How do you
one
handle
day.
it all?
Yeah, something wins one day, and then the next day something else wins. But in the end, you sort of have to keep your focus
Sure.
on the goal. We have to deal with clinical care and then leadership. I just came back from Washington, D.C. Last week we were at Capitol Hill advocating for cancer patients, clinical research, payment reforms, and prior authorization. Sometimes patients, their cancer care is delayed because I'm waiting for insurance companies to say yes because there's prior authorization. So all of those things, some of them are under our control, some of them are not, right? So for something like that, you have to go to Congress and beg them to make sure that this is forefront, right?
Sure.
Because the care of the patient depends on what the government does, depends on what insurance companies do, and what the hospitals do as well. And we believe that the patient, should really be the center of all of our focus. So trying to find time to do it all is difficult, I have to say. But in the end, we make it work, right? One day at a time.
That's right. So that was a great answer, but I want to bring us back to a specific point in time, something that we may all remember, the COVID-19 pandemic.
Of course,
right?
yeah.
So I think that was one of the greatest leadership challenges that I faced, was leading the team through the pandemic. In pediatric oncology, where care is really complex, continuity is really critical, the disruption was really immediate, really personal, and it affected patients, it affected families, and it affected staff all across the board. We had to make so many rapid decisions about how to deliver safe, high-quality care with limited information. There were evolving guidelines and very real fears. Families were very anxious. Staff were also anxious, but also stretched very thin. And yet, the one thing that didn't pause was cancer didn't pause. We didn't get a break from cancer during that time period. Yeah. So I navigated that by focusing on my 3 C's, communication, compassion, and clarity. So I made it a point to ensure that my team was well informed, even when answers were still evolving and we didn't know the final answer yet. We had frequent meetings. We encouraged open discussion. And it was really important that we validated the emotional toll that the pandemic was taking on everyone, staff and patients and families alike. We also had to rethink what patient-centered care looked like at that point. So that meant at that point expanding telehealth, reworking our treatment protocols, being incredibly intentional about what services had to remain in person, all while protecting what I consider our most vulnerable population at that time. So leading through COVID really taught me that in times of crisis, people don't need just direction. They need empathy. They need transparency. They need a leader who listens. And it was one of the hardest times of my career but I truly believe that it strengthened our team, our system, and ultimately our sense of purpose. And we came out of it much stronger than we went in.
Absolutely.
Mhm.
So speaking of what's next, right? What's next for Northwell Staten Island University Hospital? Any exciting developments on the horizon for each of you?
I think for the Cancer Center as a whole, we'll continue to work on expanding what we're doing, expanding care, expanding sites to get to where the patients are, expanding clinical trials, like
Sure.
I mentioned earlier, and then expanding our collaboration. So tomorrow I'm going to Albany. Never ends. But I'll be in Albany tomorrow because I'm on the council for cancer detection, early detection and screening and cancer prevention for New York State. But those sort of collaborative efforts in trying to make sure that we're screening patients and then preventing cancers, we get some funding from the state to be
Sure.
able to do that for our cancer patients on Staten Island. So continuing the community outreach, clinical trials, and expanding our care. It's really exciting.
Yeah, so very similar in pediatrics as well across the board. We've laid a great foundation, and we're entering a truly exciting chapter in our hospital for pediatric oncology, expanding access to the cutting-edge therapies, as I mentioned, creating access for the patients to enroll on clinical trials and receive these new innovative treatments closer to home, and also to continue to invest in our staff and employees through leadership development, wellness programming, and interpersonal education, because it's really important that we strengthen our team from within in order to continue to provide this high-quality care, both with the science and the human nature of empathy. But ultimately, what's next for us is simple, but ambitious. We want to continue to deepen the compassion, advance the science, and extend our greater reach. We want to continue to partner with communities, partner with pediatricians and other healthcare providers. We're not just expanding an oncology program. I think we're building a community of care where innovation and humanity go hand in hand, and that's so important.
Very important. I always love asking this question, and it sounds like you both deeply care about the next group of doctors that come in. So if anyone is tuning in right now that's thinking of entering the medical profession, what advice would you give them? What advice would you give your previous self when you were first joining the field?
There's too many distractions, right? In the care of patients, right? If it's not EMR, if it's whatever's happening in politics, there's always, there will always be something to distract you. But what I will tell the young ones is stay focused, right? Keep your goal. And when you need help, ask for help, right? Help is always, it's always going to be difficult.
Very important, yep.
Yep. Not everyone has unlimited resources, but every once in a while, if you need the help, ask for help, and help will be there.
So I think one of the most important lessons I've learned about empowering myself as well as the next generation, especially in a field that's emotionally demanding like pediatric oncology, is that the technical excellence is just not enough. We have to support the whole person.
Yeah.
Pediatric oncology is deeply rewarding. I couldn't do it every day if it wasn't, but it's also incredibly intense. Trainees are not just learning medicine, they're learning how to sit with families in the hardest moments of their lives, how to process their own emotions in a healthy way at the same time. So it definitely is a balance. I've learned that empowerment means creating environments where vulnerability is not seen as a weakness, but it's part of the work. And I try to model that myself as well by being honest about the emotional complexity of my field and by encouraging reflection, peer support, very important, and open conversations about burnout and resilience to try and avoid that. I also try and focus on helping the trainees find meaning in the work that we do, not by teaching just the science, but by connecting them to the why behind what we do. When they feel valued and supported and connected to the purpose, trainees will thrive. So ultimately, my lesson is this, to truly empower the next generation, I think we have to teach them how to care for others without losing themselves in the process. And that requires mentorship that is both clinically rigorous and deeply human, which we fully support and have on a continuous basis at Northwell.
Awesome. Great advice from both of you guys. We covered a lot, but what's one thing you want people to take away about your mission? What would that be?
I would say there's one life, right? We all have one life. It's limited edition. Take care of it. Take care of it. And we have to, in order to do that, we have to take care of each other. And that's absolutely important. So let's help one another, care for each other. If you have a neighbor who hasn't been to the doctor in 20 years, knock on their door, bring them to us. We'll take care of them. And that's how we grow as a community in health.
Absolutely. One message that I would take away is that every child deserves not only the best science, but the deepest compassion, and all of these things in their own backyard without unnecessary travel. My mission has always been to bridge the two, both the science and the empathy, to ensure that patients facing the unimaginable feel seen, feel supported, and surrounded by a team that's truly relentless in both expertise and empathy. And this is all local for patients so that they don't have to travel and trade away time and quality of life. Because again, there is just one life, right? Time is limited for all of us, and we want to maximize the quality of life and the moments you spend outside of the hospital, not commuting, but truly enjoying what makes you happy. So whether it's advancing treatments or mentoring the next generation or expanding access to care, everything we do comes back to the core belief that curing cancer isn't just about the medicine. It's about showing up for patients, showing up for children and their families in a way that truly honors them, truly honors their strength, and truly honors their humanity.
Absolutely.
And no bridge or ferry required for that. Stay on.
There you go.
Yeah.
If anyone is tuning in that wants to learn more or they want to support the work you're doing, what is the first call to action that they should take?
So I can just say that in cancer care and pediatric cancer care is not something any of us can do alone. It really takes a community. So whether you're a healthcare professional, a researcher, a parent, a policymaker, or just simply someone who cares, there's always something you can do to support the work. So if you're looking to get involved, you can partner with us through philanthropy, community outreach, education. We welcome all of that. Together, we can truly build a future where every child with cancer, no matter who they are, where they live, gets the care and hope and healing they deserve. I want to stress that everybody can truly play a role. So you can donate blood. You can join the registry to see if you might be a potential match for someone who might need a transplant. You can raise awareness. You can raise money to support our patients and improve their quality of life and care. All of these measures can be both life-saving and improving the quality of life for the patients. And beyond that, we can advocate for equitable access to care, support research, mentor our next generation of compassionate clinicians, or simply, and maybe most importantly, just take the time to listen to families walking through probably what they would consider the hardest time of their lives, or lend them a helping hand. Compassion really goes a long way, and I think compassion on a daily basis, your compassion matters and will matter more than you know in these scenarios.
Absolutely.
To piggyback on that, there are several walks that Northwell will host throughout the year. We have a Northwell walk that just happened a couple of weeks ago. In September, we have the Lustgarten Foundation walk. In October, we have the breast cancer walk. We have several walks that happen throughout the year. So if you're interested, please join us. SIUH is on Facebook. Go to our website. Go on LinkedIn. I'm there always. Social media. I pretend I know how to do social media, but it's important. Join us, and you can find out all of the things that we're doing. Next week, I believe on June 7th, we're having our National Cancer Survivors Day event, and where we honor our patients, our cancer patients, and their caregivers. So you're welcome to join us. It's going to be at the Hilton on Staten Island, free to join. But always, extending a hand to other people is much appreciated.
That's awesome. Great way for the whole community to get involved. Well, it sounds like at Northwell Staten Island University Hospital, you guys are doing amazing work. So thank you for that. Thank you both for sharing your journey, more insights into the field, and really a look ahead of what's next. You guys do incredible work every single day. So you should both feel extremely proud of that.
Thank you.
Thank you for having us.
Thank you for joining us. And thank you guys for tuning in this week to this week's edition of CEOs You Should Know. Tune in next week.